CDC has a $5 million scholarship for Tuskegee Airmen Descendants. The Center for Disease Control and Prevention Foundation has announced a new scholarship program for the descendants of the infamous federal Tuskegee Experiment. In this appalling study, hundreds of Black men were left untreated for syphilis for decades. The foundation launched the Voices Today for Change Tomorrow scholarship for the victims' relatives on February the 7th. According to the CDC archives, that's where that picture comes from. Now, the CDC Foundation, which describes itself as an independent nonprofit and the sole entity created by Congress to mobilize philanthropic and private sector resources to support the Centers for Disease Control and Prevention's critical health protection work, aims to raise $5 million for the Voices for Our Father's Legacy Foundation, created by Descendants in 2014. The plan is to provide $100,000 in scholarship annually. The effort follows a financial commitment from the Milbank Memorial Fund in 2022. That's according to Atlanta Black Star. Let me stop right now and just get your voice in on that, Rayyvana, because listen, people need to understand that they didn't just leave them untreated in their homes. They literally lied to these people and acted as if they were treating them, and they just wanted to see the long-term effect of what this disease would do to people. This is just one of many problems that Black people had and have with the medical system that thinks there's a higher tolerance for Black people as it pertains to pain.
Yeah, and we still see that medicalized, as you just pointed out, that medicalized racism existing today. You know, there's these ridiculous claims in our medical system that Black women have superhuman strength, and in instances where they are agitated, could engage and they become more threatening to police officers, and it's perpetuated through our health system. It's perpetuated by first responders, by paramedics, and used to justify disproportionate force used against Black women and Black men in America. As you just pointed out, the idea that Black people have higher pain tolerances is used regularly to dismiss reports of pain felt by Black people in our health system, and the legacy of these experiments has just also damaged trust between public health systems and health institutions and the Black community. And so this is the very bare minimum that they could be doing, to try to right that wrong. I'll say, the amount of money that they're promising, it sounds like a lot on paper, but I mean, as far as how far that goes in reality, I mean, goddamn, it's not enough, not nearly enough. And I don't want to just see the CDC trying to right this wrong. I'd like to see more action from, from maybe Congress, although God knows that they
That's not
aren't gonna be moving on that immediately.
right. And if we can skip to the last graphic. Because I think people need to understand, we're not talking about something that happened ancient times. This is something that happened 7 years before I was born. The unethical study was halted shortly after a blockbuster story from the Associated Press in 1972. The event often is cited as a large contributor to the medical mistrust throughout Black community, according to the AP. The men received a multi-million-dollar settlement, and President Bill Clinton called it shameful in his apology in 1997. And again, that's according to Atlanta Black Star. Now, the reason I wanted to read that is because I want people to understand that this is not unrealistic to believe that people's family were affected by that. And as Rayyvana said, that is not a lot of recourse for the family. I will say this, Bill Clinton is pretty rich that he was talking about it when he was sending dirty blood to our neighbors to the South from people that were in prison, people that he knew had diseases. He was sharing that blood, selling that blood for when he was governor of Arkansas. So I'll just say there.